I just want to kind of go ahead and share the screen. I'm going to close other things. Okay. So these are your labs. As you can see, these were collected back on the 13th. So we did a bunch of labs trying to figure out what's the cause of your neuropathy and what type of neuropathy you have. Firstly, to understand the type of neuropathy, the most helpful test was the EMG study. This was a test which Dr. Hoffman did where they poked you with needles and shocked you.
Yes.
What that showed was the neuropathy seems to be, as has been previously described, it seems to be relatively severe and chronic neuropathy. As you know, it's been going on for more than a decade or close to a decade in terms of the symptoms. And that's the kind of changes we are seeing here as well. It's been sort of slowly progressing over many, many years. And what we can see is a lot of the responses seem to be markedly reduced, which goes along with what we are seeing on your exam, like the weakness in your foot where you cannot lift your foot up.
Right.
One of the examples is this particular nerve, the fibular nerve, which supplies the muscles which lift your foot up or which prevent foot drop from happening. The normal amplitude is around 5. Yours is around 0.4. So less than, it's a very, very small amplitude, a small nerve response that we are getting. Similarly, tibial is the nerve which allows your foot to be pressed down or allows you to stand on your toes.
Mm-hmm.
The normal is more than 4 and yours is 0.1. So markedly reduced. The reason we can say it's been going on for a long time is because of the needle studies which show that those amplitudes, if you remember when Dr. Hoffman was sticking the needles, he could hear some of the sounds.
Yes.
And those sounds are which tell us whether the nerves have started to remodel. The remodeling of that nerve and muscle connection happens when the neuropathy has been going on for a long time. And we can see evidence of that without a lot of increased insertional activity, which suggests when they stick the needle, they listen to the sound for a few seconds and then ask you to move your foot up. So the initial stick is relatively calm, but when they ask you to move the foot up or activate the muscles, that's when we start seeing changes. And that again suggests a more chronic process, a slower process. When we see a slower chronic process with such reduced amplitudes, it tells us that the type of neuropathy we are dealing with is referred to as an axonal neuropathy. What that means is, if you think of your nerves to be like copper wires, axonal means the wiring inside the copper wire is getting damaged, not the insulation. If the insulation was being damaged, then that in some ways, those are the type of neuropathies we can help reverse. If the wiring is getting damaged, then the chance of recovery or reversal is much lower. The other labs we had done were primarily to look for things which can be reversed or which can be helped or can be treated. Starting with some regular blood counts, which came back to be normal as expected. But we also looked for electrolyte abnormalities or renal dysfunction or kidney problems, and we didn't see any evidence of kidney or liver issues at all in your bloods. And these are the electrolyte, and these are the kidney labs, and these are the liver labs. Sometimes people with copper deficiency or B12 deficiency, as you've had, can have neuropathy as well. But your copper, as well as now your B12, looks okay.
Oh, B12, okay.
So I think if that tells me that even though the B12 may have contributed, it's not the only cause of your neuropathy. Because if it was the only cause, your neuropathy should have gotten better as the B12 normalized. That is not the case. We also did some labs for antibodies which can be associated with neuropathies. And the only two which came back positive, or only one which came back positive, is ANA. But even that is barely above the normal. So normal is 1, yours is 1.1.
Mm-hmm.
So technically, I would call it a borderline result rather than an abnormal result. All the other antibodies which were reflexed off the NA came back to be negative. There's a test called kappa-free light chain which was elevated, but the subsequent reflex tests which are done to look for what is wrong with it all came back to be normal. So I would not be concerned about that particular test by itself. we also looked for an antibody called as MAG, which can cause slowly progressing neuropathy like the one you have, and that was found to be normal. I'm trying to see was there, and then lastly, what we did was a fat pad biopsy or a fat biopsy. Look for amyloid deposits, and in your case, we did not see any evidence of amyloidosis because that came back to be negative.
That was the one on my stomach?
Yes.
That was the one on his stomach. So, as a part of the investigations, we did testing called quantitative sensory test. Look for what type of fibers are affected, and it seems all fibers are affected, both large myelinated fibers as well as small myelinated fibers. That is causing not only for you to lose the sensation for heat and cold, but also it's impacting your balance, and that's what this particular test showed.
Well,
And then,
excuse
go
me,
ahead.
would you say that again, because
Yeah.
it was hard to catch?
So on the quantitative sensory test, we saw evidence of both large and small myelinated fibers getting impaired, suggesting the neuropathy is causing both loss of ability to sense temperature, or hot or cold, but is also contributing to balance, which you have balance issues.
So all three of them.
And then lastly, we did an autonomic reflex screen, which was to try and see is the neuropathy affecting your heart rate, blood pressure, any other modalities. And that came back to be essentially normal, which was reassuring. So all these tests give us insights into the type of neuropathy you have, but unfortunately don't necessarily give us an answer in terms of a reversible cause for neuropathy, which we can act on to stop it from getting worse. And looking at all these together, I think we'll classify your neuropathy as idiopathic neuropathy, which is sort of a term which we use when we say we can't find a cause. A big chunk of these idiopathic cases may have a genetic predisposition, and that's a test we haven't necessarily pursued. And the reason we held off that testing was because we can't, sometimes in that particular scenario, we can't really do a lot to help the neuropathy. Even if you find a gene, there's not necessarily a treatment for it. So that's why we talk to patients to decide whether that's even needed to do. So looking at these test results, even though we can't do anything to reverse the neuropathy, I think what we can do is to try and help you manage the symptoms, or how best we can help you with the neuropathy. One of the things which you were scheduled for, or which was ordered but was not necessarily, did not happen, was a PM&R consult, seeing one of our physiatry doctors. I don't see a note from them, so it seems you never met with them. These are a team of physical therapists and occupational therapists and a physician working with them.
Oh, can I explain about that?
Yes, ma'am.
We called and asked if that could be done here at Sanford, and that's probably what you're seeing.
Okay, got it. Yeah, I think if you can do it at Sanford, that should be fine.
Yeah.
I would suggest reaching out to your providers. They can put in an order, but that's going to be critical to help manage your symptoms, especially the balance.
So our doctor here has to put the order in. You don't put it in.
Yeah, I can't necessarily order things in Sanford, so
Okay.
that would be a challenge.
Okay.
Go ahead. The two more things that we talked about last time was how to manage your symptoms. I think one of the things was using some of those patches. Have you tried those?
Patches haven't I mean those lidocaine type things?
Yeah, the problem, I think we mentioned that, the problem with using lidocaine on the bottom of his feet is because the bottom of his feet don't sting and tingle anymore. That went away.
Okay, that went away. Okay. Where is there any stinging or tingling anywhere in the feet, or no more?
And my big toe, that's about it.
Okay. Have you tried a lidocaine cream?
We have that
Yeah,
here.
we got it. Yeah.
Okay. Try it on that big toe. See if that helps.
Okay.
But it seems since pain is not a big factor in your type of neuropathy, medications like gabapentin are not necessarily going to make a huge difference.
Right. We tried that for a long time.
Yeah, and I see you're on duloxetine or Cymbalta. Is that for neuropathy, or is that for anxiety or depression?
Anxiety for the duloxetine, and
Okay.
the other one is for his blood pressure.
Okay, got it. So we'll keep that on.
Okay.
The duloxetine also helps with nerve pain. So it might be actually helping that could be the reason why some of the pain at the bottom of the feet might have gone away.
Okay.
The other thing we talked about was soaking of the feet towards the end of the day with sort of lukewarm or cool water with some Epsom salt. You could try that to see if that helps. I think being active and doing sort of the therapist is where sort of it will come in handy. If they can teach you some exercises to continue to activate your muscles, especially the muscles which are still connected, would be important to sort of prolong the function. Otherwise, over time, the mobility will continue to go down. So that's where physical therapy is very important.
He does exercise for almost an hour every morning on a bike, and then he does floor exercises.
Yep. And balance exercises, but balancing ones aren't going so well.
Yeah. And that's where the therapist can help you sort of modify some of the exercises, because in your case, it might be a moving target. The exercises that were valid for you 2 years ago might not be valid for you now. So potentially working with somebody, and possibly working with somebody on a every 3 to 6 months basis going forward might be a good way to kind of manage some of the symptoms that you have as far as balance is concerned.
And so that would be a therapist
Yeah, over at
Any-
Stanford.
at Sanford.
At that point. Yeah.
Okay.
He is reluctant to walk. I try to get him to walk. Is he wrong doing that?
So remind me, do you wear braces?
No.
No, we were going to talk about that.
Yeah, I
With
think that will take away the reluctance.
Okay.
I think that's one of the main reasons I wanted you to meet with a physiatrist, because braces are going to really help you.
Would that be ankle or knee or?
Ankle braces to keep your foot up,
Oh, keep
because
your foot up.
that will remarkably improve your balance, and as your balance improves, you'll be able to walk, ambulate, exercise more, and I think it'll improve your quality of life. And they have now these carbon fiber braces which don't look like the heavy braces that used to be 10 years ago. Those are very light, easy to wear, and if you're wearing them with the shoes and socks, nobody can see them. So I think that would be the most important intervention if there's among the various things we talked about, which will help your activities of daily living.
Do I understand it keeps my foot up
Yes,
higher? Okay.
higher. So what I think one of the problems which I saw when we examined you was you have trouble clearing your toes when you walk.
Yeah.
So every time you walk, you have to lift your foot really high to clear your toes, and even that is a challenge because the type of neuropathy you have, your feet don't necessarily know where they are in space unless you're looking at them, which also makes the ground clearance a challenge. So if you take away all this thinking by wearing a brace, it will really improve your walking.
Will Sanford have those?
Yeah.
Okay.
They should have a physical therapy department which should be able to try to fit you on various braces. And if there's a concern, they have issues, they have trouble finding the right place, and they want you to be seen here, just let me know. I'll put in order to be seen here.
And will your therapy department send all the information that they were going to do to us or to Sanford?
Probably not, because since they didn't get to meet and interact with you, they're not sure what to send. So probably the best way to start is let's see what Sanford does. If you're not happy or they want another second opinion from the therapy standpoint, then I can request our therapy department to see you back, and then you may need to come back to get seen. But let's start with Sanford. They should have all the information that for neuropathy. But again, I'll mention the braces in my note again, because that's a conversation you definitely need to have with them.
Okay. Well, we've seen an article about walking with neuropathy, and it was something about keeping a rock, put your heel on first and roll. And I've been doing that, and it does help. So apparently, with keeping the toe up is going
Yeah,
to make a
and
big difference.
100%. It not only help you walk better, it'll just make you feel more confident
Yeah.
when you walk.
And then look ahead instead of down.
Exactly.
Okay.
And then should he listen to me and walk when he gets the braces, or?
I think the answer to that is yes. I don't think I can say no.
Okay, you win.
Did I understand you to say he has drop foot?
Yes.
He
yes,
does
for drop.
actually have drop foot.
Yeah.
So nothing else can be done for drop foot but what the braces and the therapy does.
So I think it depends upon the cause of the foot drop, because different things can cause foot drop. Like somebody, if they herniate a disc and pinch a nerve, that can also cause a foot drop. In that case, we do surgery. Or if somebody has an autoimmune disease affecting the nerve, that can cause foot drop. In that case, we treat the autoimmune disease. In your case, you have idiopathic neuropathy, which we can't necessarily fix with medications. So then the way we fix the foot drop is through therapy and braces.
Okay.
So what other medications should I be taking?
I think from neuropathy standpoint, none.
No. Okay.
Yeah, because medications are not the answer here. What I would suggest is make sure you're good on your minerals and vitamins, because you've been low in B12 in the past. I don't want you to go low again. If you go low, then it'll make the neuropathy get worse faster.
So I'm taking a B12 shot once a month. Should I be
Perfect.
taking a complex or a compound of B12s or?
Just
Besides.
over-the-counter B12 vitamin supplement is enough.
Is one a day enough?
One a day enough.
One a day
Yeah,
pill?
whatever, because each of the pills are different sizes, right? So just go by the recommended daily allowance at the back of the bottle.
Okay.
Okay. I would like to I have to spell it. I'm not sure if you talked about that or not. IMMUNOGLOBULIN Freelite showed abnormal high.
Yes, I did mention it. That was the kappa-free light chain.
Okay.
But the reflex testing from that came back to be normal.
Oh. Okay.
So that's why I think from the neuropathy standpoint, it's not doing much. I would suggest just letting your primary care provider know about these test results, and so that he's aware. But outside of that, I would not do anything differently.
Okay, and then the connective tissue diseases cascade.
Yes, that had an ANA which came back at 1.1
Yep.
with a normal of 1. So
Well, that's
I would say,
okay.
yeah, that's the borderline.
You did
test
say
result.
that then.
Yeah.
Okay.
Okay. Any other questions?
Our daughter is here. She'd like to ask a question if it's okay.
Okay. Yes, ma'am.
Hi.
Hi.
You mentioned the genetic testing. Would that be something that for me and my brother, for grandkids, that we would like to know about that?
I think the likelihood that we'll find an answer from the genetic testing is relatively low. It's not 0%, but it's relatively low given at what age the neuropathy started. So given the relatively low chances of us finding exactly what gene it is, the implications of the family is also not that significant.
Okay.
So I would probably, and since many of these cases we can't really do anything, if the neuropathy happens in somebody with this multiple decades later, I don't recommend strongly considering it even from the family standpoint.
If, like, you probably would recommend that if we start seeing symptoms of tingling or that kind of stuff, that we probably should.
Yeah, and then you should probably work with your provider or neurologist, but also potentially that would be a reason for you to get tested as well to try and see what's going on. But given how late this has started, my suspicion that will impact the family is low. But again, I've not seen anybody else in the family, so I'll take it with a grain of salt.
Okay, thank you.
I'd say in the last month I have progressed a lot more faster than ever before.
Yeah, and that we do get that history, because sometimes what happens is you're slowly changing over many years. and that initial slow change is not noticeable until as you reach a phase, and then all of a sudden that built up becomes, you just cross over a threshold and you feel like things have gotten worse.
Oh,
But then you see
interesting.
over the next few months things will again plateau off. There's a chance down the line you might see another. And that's where, if we have a game plan how to manage some of these deficits that you have from neuropathy, it'll allow you to live better with the neuropathy.
So just to make sure we are at the, understand everything, he's going to get braces, he's going to get therapy, and he's going to make sure he takes his vitamins. That's
Correct.
the three things.
And walk a lot.
And what? And listen to you.
Well, let's not ask for too much.
Okay. And if you think of questions as you go through this process with therapy and the braces, etc., or if you feel neuropathy does change rapidly, more rapidly than you expected, just let me know.
Okay.
I'll be happy to see you back again.
Okay. The reason we did, just so you know, the reason we didn't go to therapy at Mayo was because we are 83 years old and it's difficult for us to drive that far. And so we thought if it's not, we don't have anything against.
Okay, that's totally understandable. Yeah, and as I previously mentioned, Rochester is not a fun place. It's a very boring place.
It's interesting place.
It's an extremely interesting place and a well-organized
Oh,
place.
so well organized.
Your correspondence is nothing but good.
I'm glad to hear that. Thank you, sir. Again, if you think of more questions, feel free to reach out.
Okay.
Otherwise, have a good evening and a good weekend.
You too. Thank you very much.
And thank everybody else there too.
Will do. Bye.
Have a good day.
Thank you.